Hello, my name is Katie Schubert. I am president and CEO of the Society for Women's Health Research, which is a national nonprofit based here in Washington, D.C., dedicated to advancing women's health through science, policy, and education. And our mission is to make women's health mainstream. For more than 35 years, we've worked tirelessly to advance that mission through what I would call our relentless advocacy work. It's through this experience that we've witnessed firsthand how advocacy in women's health has evolved over time through so many iterations. Members of Congress come and go over the course of 2 or 6 years, depending on which side of the Capitol you're on, and administrations change. And here at SWHR, we've been through 5 administration transitions. But despite those changes, the core competencies of what it means to be a women's advocate continue to hold true over time. We do know, however, that there's been a lot of momentum in recent years in this space, and there's a new generation of advocates who are reshaping the landscape of healthcare to be more responsive to the realities of women's lives on everything from menopause to chronic conditions and beyond in between those things. We're seeing a growing number of people, everyone from patients to providers to researchers to caregivers, to people who are just passionate about the cause and expressing a desire to get more deeply involved in championing women's health. And we love to see that. We want you to join us, join our army that we're creating as we work to advocate for women's health research. And your voices are so needed in this work. We know that starting in advocacy can be intimidating, and that's why we created a guide from awareness to action, a guide to women's health advocacy. And it's evergreen. It's a toolkit that was designed with you as advocates in mind. Even if you don't think of yourself today as an advocate, we know that you are, and we're here to help give you the tools that you might need or to make you feel a little bit more comfortable in that endeavor. And in this guide, we break down and demystify the basics of advocacy and how to effectively engage with your elected officials. It includes easy to use planning templates and sample emails to help you create and carry out your own advocacy strategy tailored for your issue area and your district. And whether you're brand new to advocacy or looking to expand your efforts, there's something for everyone in this toolkit. So we'll be sure to share the QR code at the end of this. I hope that you'll take advantage of it. But it's not just me who's here to talk about advocacy. Today, I am joined by 3 seasoned advocates who are dedicated to advancing women's health. First, we have Lauren Rotolo, who happens to be a new board member to the Society for Women's Health Research. We are so lucky to have her. She's an author, public speaker, video producer, and content marketing leader. She's nationally recognized as a disability and women's health advocate, and through her work, she uses storytelling to humanize health, science, and lived experience. She was born with McCune-Albright syndrome, which is a rare genetic disease affecting the skeletal and endocrine system. And I'll let her share her story, but she is the youngest woman on record in the US to experience precocious puberty at just 8 months old. By the age of 5, she walked full-time with forearm crutches, and rather than allowing her diagnosis to limit her, she transformed her lived experience into purpose, advocacy, and a professional success and impact. She's the author of Unstoppable and Stilettos, has received multiple awards for her work in marketing, storytelling, and female empowerment, has advised and inspired Fortune 500 companies to more authentically integrate disability into their DE&I strategies, talent initiatives, and brand narratives. And I think she's going to have a lot to share with us about her journey, but also how she has turned her lived experience into effective advocacy. Next up, we have another friend of SWHR and mine, Erica Seward, who's the Chief Advocacy Officer of Us Against Alzheimer's. She's responsible for leading the organization's advocacy and policy, coalitions, and communications work. She has extensive experience in patient advocacy, having served as the American Lung Association's lead lobbyist for 19 years with Congress and the executive branch on issues like access to care, tobacco control, appropriations, and lung disease and lung health issues. This year, she's leading Us Against Alzheimer's Women's Brain Health Initiative and is also a founding member and original board member of the Partnership to Protect Coverage and serves as past president of the board of directors of the Coalition for Health Funding. And finally, I'm happy to introduce Sateria Venable, who is a patient advocate and researcher for uterine fibroids since 2007. Another great example of turning your lived experience into power and empowerment in the women's health space. She's the founder and CEO of the Fibroid Foundation and has advocated for more than 26 million women in the US with uterine fibroids and for those diagnosed with fibroids globally. The Fibroid Foundation reaches over 180 countries, providing support and education to erase menstrual stigmas. She has done so many things in the women's health space related to fibroids and beyond, going into the healthy aging space and menopause, and has been the recipient and working with directly the National Institutes of Health on research related to uterine fibroids, which is really exciting. And again, part of this is to hopefully provide some hope and optimism as we think about how we can really turn this advocacy into action. I want to thank each and every one of you for joining the conversation. I'm really excited to hear your expert insights on how those who are watching can use this toolkit and become an impactful women's health advocate. So before we get to our wonderful speakers, I want to lay the groundwork for why women's health advocacy matters. And I've seen the power of advocacy in driving the field forward. I am a former congressional staffer. I am a former lobbyist, a registered lobbyist, worked at a lobbying firm, was a chief advocacy officer for maternal fetal medicine before coming over to the society. And so understand that it truly makes the voice of those who are impacted by policy matter to make that change. I do want to lay the groundwork a little bit in terms of why this is a problem. A lot of times people don't necessarily think too much about this, but it wasn't until 1993, which was not that long ago, that the NIH Revitalization Act finally required that women be included in federal clinical trial research. Before that, women were intentionally and actively excluded from research due to concerns surrounding their reproductive health. And the thinking was legitimately that women were just little men. And so you could just extrapolate out the data in the male population and understand what that would mean for women and women's health. We obviously know that that is not true, but that is the reason why the Society for Women's Health Research was created, to work against that thinking, to work to advocate for the NIH Revitalization Act and ensure that researchers were able to look at things like sex differences. It turns out there are differences between men and women, and we want to make sure that we're understanding those details so that we can receive personalized medicine. So the change required and the advocacy required to make that actual change wouldn't have been possible without the collective efforts of advocates who were raising the alarm on the short-sightedness of how we understood the research. And so thanks to the NIH Revitalization Act, we now do have a better understanding of women's health and sex differences, but we do have a very long way to go. So that change, which was related to sex differences, so sex as a biological variable is what we call it, or SABV, wasn't actually something that was required for researchers to just consider until 2016. So we're coming up on, actually in a few weeks, January 25th, the 10-year anniversary of the implementation of that policy. That one was not a law. It was an internal policy at the NIH, and we continue to look to make sure that that's being implemented properly. But it's really aimed at making sure that researchers have the tools that they need to fully understand how to consider sex differences, why they should consider sex differences, and then as we think about translating that research into policy and care, whether it matters for men versus women. So really important things here as we're thinking about it. So you can have advocacy thinking about the congressional branch, as I mentioned, the legislative change. You can think about the executive branch and the regulatory agencies like the NIH with the Food and Drug Administration. We've seen that happen as well. And all of that can influence how legislation is introduced, amended, passed, and then the implementation side of it, which is really up to the administration. There's also the judicial branch, obviously, when we're thinking about the three legs of the stool in our federal government. And legal advocacy can impact landmark court decisions and interpretations of constitutional rights. So there are lots of ways to think about advocacy on the policy side, but there's also ways to think about advocacy from a personal standpoint as well, which we will get into. All of this is to say that advocacy, in short, is a way to drive positive change and hold our institutions accountable, and will ultimately make our lives better and healthier. When we think of advocacy, we usually think of it in terms of the policy angle, in terms of with Congress. But obviously, as we just talked about, it can take many forms and has value across spaces.